Well, good morning, everyone, and thank you again for attending another awesome monthly webinar here at Cherokee Investments and Bank Cherokee. We got a really exciting topic today. I know a lot of people, starting with October 1st, are thinking about their open enrollment for their Medicare, and we know that health insurance is a really big part of our clients' financial planning issues and the costs and whether or not they have the right plans or don't have the right plans. And so we have an awesome expert in Kirk Porcel today. He's going to talk a little bit about educating us on how it works and what we should think about. And then if you feel like you have a question throughout the workshop today, please go ahead and enter it in the questions box, and then we'll answer those throughout the presentation. I think the best way for you to get the answers you want will be as if you're able to ask them throughout the presentation and where it's timely and where it makes sense. So just go ahead, put it in the box, type it in there. We won't have any audio for you to be able to speak. We have that on mute, but go ahead and enter your questions and we'll hopefully get to all of those today. And then at the end of the presentation, we'll do a little bit of wrap up if you have questions then as well. And then, of course, we'll give you the contact information so you can reach out to Kirk or I and make sure that you get everything you need to make sure you're really well positioned for your health insurance needs and Medicare. So I'm going to turn it over to Kirk, who has years and years of experience in this area. He works closely with our clients, and we're really happy and privileged to have him here today. So, Kirk, go ahead and take us away, buddy. Thank you.
Hey, how's everybody doing today? Thank you so much for being here. I will apologize in advance. I have been called a Medicare nerd, and I love what I do here. So I get a little excited about it. We'll have a little fun with this today. The one thing that really makes this a great presentation, folks, is if we are doing a conversation more than a presentation. So I'm going to ask you something that not too many people actually are ever told, but please interrupt me whenever. I would much rather have you interrupt me, and we can get this thing rolling, and I'm really excited to share it all with you. So now I'm going to try and share my screen with you guys, and we will. I'm going to make sure I get this up, and again, any questions, feel free to give me a yell, okay? Let's go here. All right, can everybody see my screen? John, you guys, can you see my screen? It says Medicare 101 on it.
You are good.
Perfect, perfect. So I have been in the Medicare industry for a long time. I absolutely love what I do. I have had an opportunity to work in this niche, and it's become a passion of mine. I love helping people through this process. So the one thing that we get that we start this whole thing off with is what is Medicare? What are we doing? So today's kind of going to be a little bit of educational. If you have questions specific to your plan, I'm more than happy to answer those one-on-one. As a matter of fact, since we've actually been sitting at home for 18 months or 2 years, there's probably a lot of things that have changed over the last 24 months that I'd be more than happy to share with you. I will tell you, most of those have been great changes. We do have some things that we need to be concerned about, but if you have any questions whatsoever, please give me a yell, and I will help you with that. I am an independent insurance agent, so I have almost all the plans in the area. I don't stick to just one or the other. That helps me be able to do the right thing for you, not you fitting into a plan, but a plan that fits you. So we can take a look at those things. If you got a great plan, that's exactly what I'll tell you. And if we can help at all or improve your plan, I'd be more than happy to do that too. Humbled that you came today. We really appreciate that. And let's get rolling. I'll quit talking here too much. So see if I can get this thing going. Why can't I? There we go. All right. So the first thing we think about is information overload. If you're just turning 65 or you're retiring right now, you are getting information overload. It's in your mailbox, it's in your email. You may be getting illegal telephone calls. And I will give you this tip, folks. If you're getting calls about Medicare, please just tell them this is an illegal call. They will hang up quickly and take you off their list, hopefully, if they're smart. So make sure you get that. But we're getting a lot of overload. We go to the coffee shops and everybody's got the right answers. Well, today I'm going to give you the right answers. And then if you have any other questions, you can give me a call. Okay? So this is what our Medicare card looks like. John Smith here was happy enough to share his card. When you get into Medicare and when you start with Medicare insurance, you need to have Part A and Part B. Okay, and you'll see down here that you have start dates by both of these. You have to have these in here. You know the old saying, nothing's sure in life but death and taxes. Well, when you turn 65 or retire, you have to have Part A and Part B, regardless of what side you go to. So how do you apply for Medicare? Well, that's pretty simple, right? As they say anyway. If you're receiving Social Security benefits before 65, I want to say that again. If you're receiving Social Security benefits before age 65, you will be automatically enrolled in Part A and Part B, and you will get that card in the mail approximately 90 days prior to your 65th birthday. That's if you're already enrolled in Social Security and receiving Social Security. If you haven't signed up for Social Security benefits, you have to proactively sign up for Parts A and Parts B. Now, the best thing to do here, if you can handle a computer and you can go online and do it, God bless you, that's awesome. I have a little bit of a hard time with that. I know just enough to do my job really well. But if you're going to call, and this is advice from my customers that I have right now, call between 8 and 9 a.m. in the morning, because that is the time you will spend the least time on hold. Everybody seems to think Social Security and Medicare, we always think, oh my goodness, they must be like the DMV. Well, they're not. Social Security, once you get a person on the line, they're very, very good at what they do. They're very efficient, and you'll have a really good experience there. I feel pretty good about that. So you can go online, you can do it on phone, or you can actually go into a Social Security office, which I believe are back open now. So Medicare 101, we're going to do a little alphabet soup here. So original Medicare is Part A and Part B, okay? Part A is hospital coverage, Part B is medical coverage. Now, we've all heard about Part C and Part D, okay? Part A and Part B are issued by the government, okay? Part C and Part D are administered by insurance companies. These come from private insurance companies, okay? We're gonna get into this a little bit further. So, and again, any questions, stop me and ask those questions as we go here. Part A, this is the hospital portion of Medicare. I call this bricks and sticks, okay? So this is hospitals, hospice care, home health care, skilled nursing facilities, something like that. There's usually, and I haven't run into anybody yet that's had to pay for Part A. As long as you've worked 40 quarters in your life and paid into Medicare and Social Security, you're entitled to Part A for zero. If you haven't done that, you know, you get you'll see the 2 monthly premiums here. So again, Part A, hospital portion, inpatient hospital, skilled nursing facility, hospice care, home health care. Sounds like great coverage. When you have Part A and Part A alone, you pay a deductible of $1,484. Now, I'm also, folks, giving you 2021, what am I trying to say? 2021 rates. These will fluctuate by the year. Now, this is each benefit period. Now, that benefit period is usually about 60 days. So, for example, you go in the hospital on January 1st, you pay that $1,484 deductible. And if you go back in February, you don't have to pay it again. But if you went back in March, you'd have to pay it again. So you can actually be charged this up to 6 times a year. I always tell people, I said, if you're being charged at 6 times a year, you got more to worry about than the money part, right? And then, of course, skilled nursing facility, when they're done with you in the hospital and you still have time for rehab, you get $0 for the first 20 days of each benefit period, once again. So, and you'll see the co-pays on here. I won't bore you and go through all of that, but if you have any questions, feel free to ask, okay? Part B, medical portion. I call this people and procedures. So that's your doctors, your nurses, your procedures, your $8 Band-Aids, and $12 aspirin. And believe it or not, I have an invoice that shows a $12 aspirin from my first cancer surgery. It's kind of scary. I feel like maybe I'm in the wrong business. But most people this year are going to pay $148.50 per month. One thing to know about your Medicare Part B premium is it will go up a little bit every year, and it usually is just a little bit. It went from $144.60 in 2020 to $148.50 in 2021. We won't be probably made aware of what 2022 is probably until mid-November. That's usually when they do it. Maybe they'll be earlier this year. I'm sure it's sitting on somebody's desk and they just haven't done anything with it yet. But so people on Medicare with annual incomes over $88,000 or $176,000 will pay more. And I'm going to bring that up in just a sec. It's called IRMA adjustment, okay? Amounts determined using your modified gross income. That's a 2-year look back. Okay, so they're going to look back 2 years and do your average income for 2 years. If you have a good financial planner like John, he can help you with these things. But always take a look at that 2-year look back. And as you go, that's a rolling 2-year look back. And people, of course, with lower incomes may qualify for extra financial help. I will tell you this, as you do get into retirement and maybe you're considering moving or selling the lake home to put it in your retirement, talk to folks like John. They have a really good advice on how to handle that so that doesn't beat you up too much on the Medicare side of things. So this is the IRMA adjustment. Okay, so again, remember they go back 2 years and they average that income out. So as you can see, if you're under 88,000, you pay 148.50, and if you're over $500,000 a year, you're paying 504.90. I did have one person call me up and she was very upset about having to pay 504.90, and I, as much as I understood it, I also congratulated her for having a good couple years of work and income. So there is that adjustment in there. If we like it or not, it is what it is, and it's kind of what what we have to deal with. Again, these numbers will fluctuate a little bit when it comes to on a yearly basis. So, are you required to roll in Part B? Here's what I call one of those coffee shop questions, right? You sit around the coffee shop, everybody's talking, they tell you when you have to do this and when you have to do that, and blah, blah, blah. We're going to answer those questions here today, folks. So, are you required to enroll in Part B? No. Part B is voluntary. However, if you decline Part B, you may be subject to a 10% penalty for each year you fail to apply. What we do in our agency is we make darn sure that there's A, no lapse in your coverage between health insurance and Medicare, and B, we stay away from that penalty. We want to make darn sure we do that. So, for example, the penalty is the 10% per month for what the 1 year is. So you take the 1 year times the current Part B, which right now is $148.50. So you would have that $14.85 penalty put on each month for the rest of your life. Doesn't seem like a whole lot, but when you're paying that over a period of 30 years that you hopefully will live, that can be very expensive. So, and Part B penalty does raise and lower as the Part B premiums adjust. I will tell you, I haven't seen it ever go lower. So, maybe we'll see it this year. Wouldn't that be kind of cool? So, don't think the government's going to give money back, but we'll see what happens. So, can you delay Part B? Absolutely, you can delay Part B. So, if you are actively working and covered by group health insurance, okay, if you are going to work past 65 and keep on your group health insurance, you can absolutely delay Part B. If you are a spouse that is actively working, if your spouse is actively working and you are covered under their group health insurance, yes, you can delay Part B. Now, I will tell you this, just as a piece of advice, when you get to that point, when you're getting to be 65 and you have a decision to either go on to Medicare or stay in your group health insurance, it's really, really a wise decision to sit down and look at those numbers pragmatically, put a spreadsheet together and look at those numbers. And I can help you with that. I've got a spreadsheet that I do, because sometimes we find that being on Medicare, even though you're still working, is cheaper, and believe it or not, the coverage is better. So always a thought to do that. And again, numbers don't lie if we don't lie about the numbers. So if we put the numbers down and it goes one way or the other, we know exactly where we need to go. Part B is the medical portion, like we talked about. So doctor services, outpatient care, labs and x-rays, physical, occupational, chemotherapy, surgeons, and anesthesiologists. So yes, this covers everything medically related. Now, Part B coverage. Yes, sir.
We have our first question.
All right.
Somebody is asking, what if they're in work comp and they're over 65, but they're paying a health insurance premium each month? Does that affect how they should look at this?
Well, that's a really great question. And if they're paying a health insurance premium, that would mean that they would have, they would have credible health insurance coverage. Being on workers' comp I believe that still would cover them, because the big key here is that you are actually enrolled in your health plan. So I don't think the work comp thing would affect it. It would just be that you actually have that credible insurance. And if you're paying that premium every month, you'll still do have that. Does that make sense?
And so would they want to review whether or not they should be going on Medicare then, or they kind of already have a plan because of workman's comp? Or I think that's kind of what they're asking.
Oh, I would absolutely review it, because either way, you're still paying that health insurance premium. And when you come off for workers' comp, or, you're still going to have that health insurance premium, and you're still going to have that same health insurance plan. So absolutely, I would 100% still take a look at it. The worst thing that can happen is, hey, you're good where you're at. That's a good thing, right? I mean, we don't have any problem with that, but I'd always look at it, because I always tell people, this is your money. Let's get the biggest bang for your buck. I think that's an important thing.
Excellent.
Cool. Did that answer the question?
Yep, excellent. Thank you very much.
Perfect. No worries. So yeah, folks, ask questions. I love questions. So Medicare Part B coverage, you have a $203 deductible. So right off the top, you pay $203. That's your annual deductible. That doesn't sound too bad. Then you get 20% of the Medicare fee schedule. So you go into the hospital. I'm just going to use numbers. I'm not trying to scare anybody here. I just want to use numbers that will make sense to people. So say you have a heart attack, you go in the hospital, you're there for a couple of weeks, and you spend a couple $100,000, which, by the way, is not difficult. I've actually spent $1.5 million over at St. John's here in Maplewood with my cancer surgeries. So you go in, you spend $200,000. Now you got to pay, Medicare pays 80% of that, but you have to pay 20% of that. So 20,000, or 20% of 200,000 is $40,000. The problem with this 20% is we do not have a limit on that. There's no financial cap on that 20%. So that's where we run into trouble when we're just on original Medicare Part A and Part B. With the insurance plans, regardless if it is a Medicare Supplement or a Medicare Advantage plan, we put a solid financial cap on what your spending limit is for that year. And you actually, believe it or not, get to choose that depending on what premium and what carrier you want to go with. But that is one of the issues. So we have two holes to fill here. We have that Medicare Part A deductible hole, and then we have Medicare Part B, that 20%. Those are huge holes that we fill with Medicare insurance. All right, how do we fill those gaps? Gosh, I'm just getting ahead of myself here. I apologize. So we have a Medicare Supplement or a Medicare Advantage plans, okay? Now, I want to make this clear, because this is always confuses people. A Medicare Supplement and a Medigap plan are exactly the same thing. So if you hear Medigap or Medicare Supplement, they're exactly the same thing. Congratulations to the government for giving it two different names and confusing people. Now, with these things, you do have to get a Part D prescription drug plan. Now, as you see down below here, it says we have 10 plans, A, B, C, D, F, G. Minnesota is one of 3 states in the country, ourselves, Massachusetts, and Wisconsin. We have 3 plans. We make it very, very simple and very easy to select your Medigap plan, because we've kind of condensed it down into a couple 3 plans that we get a choice of, and you take a look at it and go from there. So we don't have what I call alphabet soup there. Medicare Advantage plans is also considered Medicare Part C. These are HMOs, PPOs, private fee-for-service plans, special needs plans, and they can be purchased with or without drug coverage. Most of these plans have Part D wrapped right in them. Very, very convenient. All right, here we go. So the difference between the 2 plans, there's good and bad on both sides. And this is really more your choice as you look at these things. And again, we have spreadsheets showing the differences between the 2 when it comes to costs and dollar signs and things like that. So with Medicare Advantage, you generally have low or no premiums. Yes, as much as I cannot stand listening to Joe Namath tell everybody, let's not call them lies, but inaccuracies about what that whole program is, there are such things as $0 plans. Medigap plans have higher premiums. Medigap plans also do not include drug coverage, so you need to get the Part D drug plan. Medicare Advantage plans almost all the time usually include prescription drug coverage. Medicare Advantage plans have cost sharing or out-of-pocket expenses such as copays and co-insurances. And here's a quick quiz for you. Does anybody know what the difference is between copays and co-insurance? And I'll bring that up in a second here. I hope we get some answers, but there is a difference there, and it's very simple, but very poignant to what we're talking about today. Medigap plans have very little cost sharing or out-of-pocket expenses. They also don't have a provider network. So you can go to anybody who takes Medicare in the United States on a Medigap plan. Medicare Advantages do have a provider network. Some of them are very small. Some of them are very, very large. Some of them, from a pay perspective, don't even have, well, they have a network, but from a pay perspective, you can go just about anywhere you want. So Medicare Advantage plans also, the benefits are provided by an insurance company, not Medicare, okay? And I'll explain that to you personally if you want to know how exactly that is, but it's pretty cool how they do that. Medigap plans, it's exactly what it says. Medicare pays first, Medigap fills in the gap and pays second, okay? So Medicare pays, Medigap pays second on the Medigap side. And of course, Medigap doesn't include the extra benefits like dental, vision, and hearing, and all of those extra stuff are included on the Medicare Advantage side. And they get better every year. They've been enhancing these benefits over the last 5 years. It's really, really cool. So how do you enroll in a Medigap plan? Pretty simple. You don't really have an enrollment window, but you have to have Part A and Part B. Remember, like I said before, like death and taxes, got to have a Part A and Part B. There's a guarantee issue window. That means you can get in. It doesn't matter what you have. It doesn't matter your pre-existing conditions. You have to do that within 6 months of your Part B effective date. So if your birthday is November and you started your Part B date in November, you would have 6 months out through May to actually get into a Medigap plan without any underwriting questions. If you're past that 6 months, you may be subject to health underwriting. And again, these change with carrier. Some of the carriers are very conservative, some of them are very liberal and easygoing, but you can be turned down outside of that 6 month window. So the exceptions to that are obviously losing group coverage, involuntary or voluntary, however that works, or moving out of the area. If you move out of the area of your Medigap plan, you get a 63-day mini guarantee window for certain Medicare supplement plans. So here we go. No questions yet today, huh? I got one good question. That's good. I'm going to make this a little bigger because, boy, they did a bad job when they made this particular slide. So this is a slide for Medicare Advantage, okay? When are you eligible? Well, you have to be 65 years old, or you have to be under 65 and qualify on the basis of a disability or other special situation. So if you're on Social Security disability and you've been on that for 24 months, you can apply for Medicare. A lot of people don't know that, but if you are on Social Security disability and you've been on it for 24 months, you can apply for Medicare and get approved to be on Medicare. And of course, you have to be a U.S. citizen or a legal resident who has lived in the U.S. for at least 5 consecutive years. If you are an immigrant to this country and you just got here, you probably wouldn't be able to get Medicare. But there are some great health plans that you can get into as well. So we can help you with that as well. There's a couple of really cool enrollment periods when it comes to Medicare Advantage. The first one's an initial enrollment period. You take your birthday, you go 3 months before your birthday, and you take your birth month and you go 3 months after. So you get the 7-month window to apply in your initial enrollment period. Again, the one thing we always want to be careful with is we want to stay away from those late enrollment penalties. But at Pulsell Agency, we will help you with that. We will make darn sure that we do this in a very we kind of get ahead of the game a little bit and we get this done absolutely perfectly so we don't have any lapse in coverage. That's a big deal. So we want to make sure we're there. Now you're into, let's say you're into, yes, sir.
We have a question related to if you're a military veteran, are these plans the same or would there be something else that person should be looking at?
You know, that is a fantastic question. Thank you for that. Because there are plans for veterans out there. So the kind of the parameters to them. They're called vet plans, and they don't include drug coverage, because if you're getting your drugs from the VA, there are actually $0 plans for veterans that enhance what they have if they, depending on their level of VA coverage, or if they have TRICARE for life. These enhance them. They don't step on them. They don't interrupt with anything. They enhance what they have. So you will actually get all the extra benefits that go along with these plans on top of what you have with VA. But the one kind of big kicker to that, John, is that you're getting your drugs from the VA. If you have that, I tell you what, there's some fantastic things out there. And guess what these plans cost? They're $0. We take care of our vets in this business, and I really do appreciate that, because that's a big deal to me. So you can get a vet plan for a $0 plan, and it works really well. Contact me. I would love to help. I have a very big passion for veterans. I actually volunteer to help veterans with their Medicare issues. So anything you need help with, I will help you. Be honored to do so. Did that answer that question, John?
Yep, we are good. Thank you so much.
You bet. So once you're into a Medicare Advantage plan, now you have an annual election period, right? Or an annual enrollment period, it's called. And that goes from October 15th to December 7th. And in this time, you can change your plan 10 times if you want. If you have a really good insurance agent, they'll call you sometime between the 1st and the 15th to make you aware of what's going on for next year. And if you do decide to change, you can change between October 15th and December 7th. We always call our folks early October when we can actually start talking about these plans, so you are completely aware of what's going on for next year, so we can look ahead and kind of plan ahead on that. And then after that, there's an open enrollment period between January 1st and March 31st, where we can go, oh gosh darn it, maybe this isn't the right plan for me. Well, you can go between January 1st and March 31st and change your plan one time, and then you're kind of locked in for the rest of the year. But you can change it there one time. I want to see what we're doing here on time. We have a really great story here. Maybe we can share that one-on-one. Then, of course, there's always the special enrollment periods. You know, you're working and you're retiring. You moved into a different area. Those things are special enrollment periods. Always give us a call. We can always help you and find out if you have a special enrollment period available to you as well. So any other questions on that, just let me know. And if you do qualify for low-income subsidies or anything like that, we can certainly be able to help you with that as well. Now I got to get this down so I can change screens. I apologize for the delay here. For some reason, this isn't working. There we go. Okay. Prescription drug coverage, Part D. Yay! We always talk about this, but this is important too. It comes from a private insurance company. Part D will help you lower your costs and protect you against high unexpected drug charges. This is a good program. Now remember, Part D in a Medicare Advantage plan is wrapped right into it, so you don't even have to think about this. But if you're going with a Medigap plan, we got to talk about Part D. Guarantee issued during certain enrollment periods, like the one we're in right now with the annual election period here coming up on the 15th. It is voluntary, but you will be penalized without qualified drug coverage. So just like Part B, if you don't have Part D, when you need to have Part D, there is a late enrollment. Now, people sometimes snicker a little bit at this, but it is 1% of the base beneficiary premium for each month enrolled is delayed unless beneficiary, of course, has credible drug coverage. Now, if you have a group health coverage, you got credible drug coverage, so you don't have to worry about that. But let's just take for an example here. Say the prevailing drug coverage cost this year is about $40. It actually is about $40. If you take 1% of that for 1 month that you missed, well, it's 40 cents, right? But miss that for a whole year, take that 40 cents times 12 months, and it's $4.80. Again, doesn't seem like a whole lot until it goes on, until it gets added on to that Part D coverage every month for the rest of your life. So again, it's a lot. It's really easy to keep away from that penalty. We're more than happy to help you with it here at the Full Sail Agency. So there are a couple of stages that we work through with prescription drugs, and I'll run through those here quickly. The annual deductible. Now, a lot of plans, believe it or not, for next year are actually getting rid of annual deductibles, which is really cool. But if you have an annual deductible, you pay 100% until you reach the plan deductible. Okay. Then you go into the initial coverage period, that copay or co-insurance. You know, if it's tier 1 might be 0, tier 3 might be $47, and there's different percentages to that. You pay
Sir?
that copay. Yes, sir.
We have a question related to a person is asking, how would they know if they should take the drug coverage if they're not currently on drugs or prescription medicine, but they don't want to get penalized for not taking coverage?
Well, that's a great question. God bless you for not taking them or not having to take any. That's really awesome. Last year, I talked to hundreds of people a year. I ran into 14 people last year that weren't taking any drugs. So God bless you. That's really awesome. So if that's the case and you're really healthy and you really want to avoid that late enrollment fee, you can always go into a $0 plan that has that drug plan embedded right into it. Then you're not paying for the drug plan, but it's part of the drug plan, and you get some coverage as well, right? So there's always options to doing that. And I think, you know, again, it's great that you're not taking any drugs. I think that's fantastic, but there are options that we can do there, and I can run through those for you. And there are some really, because yeah, it's kind of angering that, you know, I'm not taking any drugs, but I have to have a drug plan. Are you kidding me? Well, if we can pay 0 for it, that's pretty good. So yes, there are options for that, sir.
Excellent, thank you.
You got it. So after you've spent total drug costs, we're in the initial coverage area here. So total drug costs now reach $4,130. And what that means what you've paid, what your annual deductibles paid, and what the insurance company has paid. Once that reaches $4,130, you go into the coverage gap, or what they call a donut hole, which I find really offensive because I love donuts. Why would they put that there? But so you get into the coverage gap. Now, what follows you into that coverage gap is your annual deductible and everything you paid in the initial coverage stage, okay? Now we spend our way out of this. So it's 25% of all your drug costs you will now be responsible for until you get to $6,550 out of your pocket. So now it's not total drug costs, it's total out-of-pocket costs reach $6,550. Then you go into the catastrophic stage, and we all take a deep breath, right? $370 for generic drugs, $920 for all other drugs, or 5% co-insurance for drugs, whichever is greater. Now, this is a great safety net, but I just want to warn you. So, for example, I take a cancer drug and I pay $11,716 a month, right? So let's just round it up to 12,000 because I'm not that good at math. So in this plan, if I were in this plan, and if you ever get to that point, folks, side note right now, if you're ever to that point where you're paying a lot of money for drugs, give us a call. We have some pharmacy advocates that will work on your behalf to help you with those copays. Great people. I love them to death. They save me about $8,000 a year, to be honest with you. But on this particular plan, if I'm paying $12,000 a month, I would have a copay of $600. Now, I would much rather pay $600 than $12,000. So then that goes out through the end of the calendar year, and then we start back over again on January 1st. And we're here to help, okay? If you need help, call us. If you have any questions about what plan you're on right now, and if that plan's the best plan you're on, we will help you. And we will be very honest with you and tell you, hey, you know what? You've got the best plan you can possibly have right now, which is just fine. If there's something we can do to help, we will do that. But give us a call. We're more than happy to help you out with that. So, you know, take down my number if you'd like. It's 612-747-2726, or, you know, email me, or you can text me on that number I just gave you as well. And boy, if there's any questions now, I am more than happy to answer them, excuse me.
Well, Kurt, let's wait a minute here and see if people have a few questions, and we can maybe answer them. And I don't know, maybe you want to turn your camera on, and then those people can put it into the question box.
And the one thing, you know, with COVID, you know, when we've kind of sat tight on a lot of things. And I will tell you that, I can't find my mouse here. I will tell you that we have really, the plans in the last couple of years have really, in most cases, have gotten better. So there are some really good things out there that people should probably take a look at their plan and just say, hey, what's changed on my plan? Or, you know, is there another plan out there that came out that was better? That kind of thing. We do unfortunately have some plans that have taken the negative side of things as well, and that's something to actually be very cognizant about as well.
We do have a question, Kirk.
Yes, sir.
The question is, I've had my Medicare plan coverage for a long time. What would be the process, or how hard would it be to review that? Like, what would I have to do?
Very easy. You know what? We could do it over phone call. We could do it over Zoom. I love meeting for a cup of coffee. It would be just looking at your plan, the plan you have right now, and let's take a look and compare it to what else is out there. The one thing we have to be super careful with, John, is that we want to make sure that their doctors fit into a different plan if they're going to look. Their prescriptions are right for this plan. So we kind of do that due diligence and make sure that if we're going to change, we're going to do it for the right reasons, and we're doing it to the benefit of the customer. So we absolutely, it can be a 5-minute call, depending on what the situation is, or like I said, we can sit down and just look at it, plan to plan and take a look at it.
They have a follow-up. They're asking, in your experience, what are some of the major things that might have changed then if they've had the same plan for a really long time? What would be like an update in a sense?
Well, I can't talk about that today. But Medicare says we can't talk about particular plans, but I can give you an example. So travel benefits, right? 5 years ago, if we're talking about travel benefits, we're talking about you have travel benefits in 6 states, the Sun Belt states, right? Or the snowbird states. Up to this year, most plans have travel benefits that cover all 50 states. So the improvements in these plans have been that significant. Without getting into plan benefits, which we can't do here, we can certainly go over that. But there have been some really neat, eye-opening things that have happened that I think will, if you haven't checked your plan for a couple of years, you might be pleasantly surprised, and it might be a really great conversation.
I guess we have another one then. So what is your recommendation if I spend half a season in Florida and half a season in Minnesota? Is that complicated?
No, not as complicated as it used to be. It's not as complicated. There are some parameters to that, but not that big of a deal. As long as you're keeping your residence here in Minnesota and you have your primary residence here in Minnesota, we can work on plans through Minnesota, and that benefit can happen 5 months and 29 days in Florida. So it's as long as you have that residence here in Minnesota, we can certainly work with you.
Excellent. Okay. I don't see any other questions. Again, because we have the audio off, if you have a question, we have a few more minutes. Feel free to put it into the questions box, and then I can repeat it to Kirk so he could answer that for you. I think you can see he's very versed in this piece of the Medicare and Medicaid and health insurance industry. And part of our clients, as I mentioned at the beginning, when we're doing the financial planning, is figuring out how this cost is going to affect our clients when they retire or when they get to 65, and figuring that all out. And of course, assembling a great team. So when you look at having your attorney and you have your CPA, you have your financial advisor, we want to have an expert, of course, on the healthcare, because there's always changing, very complex, sometimes nuances that I think a person like Kirk can really help you and I figure out what's the best place to look and what's the best match for you. So I don't see any more questions. So I'm going to thank Kirk, and I thank everyone for attending today. I think we got a lot of great information. Again, follow up with Kirk, or if you want to reach out to your banker here at Bank Cherokee or myself at Cherokee Investments, let us know what you'd like to get some feedback on, or if you'd like some information sent out to you, we can reach out to Kirk on your behalf. But otherwise, feel free to go ahead and contact him directly and get the information that can really help you in this open window before the year end. So
awesome.
Again,
thank you guys so much. Thank you so much for having me, you guys. I love working with Bank Cherokee. You guys are awesome. And John's just a great guy when it comes to financial planning. You are going to be in the right position working with him.
Excellent. Again, thank you so much, folks. Have a great day, and we'll see you next month at the next webinar.